likes to stay outside for at least a good 20 minutes, 30 minutes after he has his meal. Takes a little nap in the cool air. Is synthetic B1 mononitrate okay to take? It depends what you want to use it for. I like the thiamine. I don't know why you want to go with the mononitrate unless you're using it to actually boost up your nitrate levels. The problem is with the mononitrate, it's not going to boost it up as much. For a while, L-theanine and ashwagandha was helping with deep sleep, but not anymore. You have to cycle off. John, you have to cycle off your ashwagandha. Quite a bit, like at least usually I cycle it off every 45 days for about 5 to 7 days off. And the L-theanine, if you don't cycle it off, then you'll have to actually increase the dose. So probably it would be ideal to kind of cycle it. I take close to about 400 milligrams of L-theanine right now. I bought your protocol book. Do I need to do everything in the section or pick and choose? Which one did you get? Which protocol book, Crystal, just so I can get an idea. Because I do put a lot of options in some of them. It doesn't mean that you have to go through everything, but you can pick and choose for at least, it depends which one you got. Oh, the cheat sheet. Okay, yeah, you have to pick at least probably 2 or 3 items from the list. You can't just pick everything. Picking everything, it becomes quite insane because there's no point. So the only reason I gave out so many options this way, you can pick and choose what's available in your country, in your area, locally, and that would be an ideal thing. But I would say at least you want to pick at least 3 items per issue you were actually looking to fix, for example. And keep in mind, some of the stuff, it depends where you're trying to kind of fix or cure. It depends. Sometimes it could take a little bit longer than usual, but you have to kind of stay consistent with the supplementation as well too. Hey, Antonio, how are you? So it's like this with a lot of the supplementation, because we know a lot of the supplementation don't just work overnight, right? So a lot of the stuff is going to take some time, and it can take anywhere between 6 to 8 weeks before you kind of notice a difference. Some you might actually feel a difference instantly. Some might take a little bit longer than usual. It's interesting about copper. I was taking zinc without it for years. Last year I started taking it. Yeah, make sure you maintain it at least 7-to-1 ratio. So every 7 milligrams of zinc, include at least 1 milligram of copper, or you can actually get some copper cups. So you can actually drink from copper cup, and every 1 liter will give you roughly about 2 milligrams of copper. How do you get 169 iron 11 out of my body? I have high LDL, HDL, triglyceride. Your triglyceride to HDL ratio is good. To get rid of the iron, what you have to do is you can either donate blood. That's one option. That will actually lower your iron. You can actually don't cook with a lot of skillet, or take vitamin C whenever you eat red meat, because that will actually enhance the absorption of iron. If you include calcium and high fiber, it actually flushes out the iron from the body as well, and from the food. So there's few things you can definitely do. I take 4 milligrams of copper per day. Maybe you could take a little more. You just gotta be careful. You can't really take too much copper, because it does or it could cause a slight toxic effect on the liver. So just kind of be careful. I've taken as high as 20 milligrams, but I've always kept it as a ratio 7-to-1. How can you raise your good cholesterol? Cheeses. You can have olive oil, you can have coconut oil, MCT, all that stuff will raise your good HDL levels. And if you can't, you can also add a niacin if you want. Why does running Why does running feel so good for my mental health? If I don't run, I feel not as good. It's oxygen flow, blood flow. You're stimulating everything in your body. For example, I go on my rogue machine right behind me. Every time I feel like I have a headache or I don't feel good or I have some kind of anxiety or stress coming on, I just jump on the rogue machine for about 15, 30 seconds, high intensity, or I might do maybe like 2 minutes of medium intensity, and I feel good after. I feel good for a good an hour or 2 hours. So it's all about the oxygen flow and the blood flow in the body. Hello from Vancouver. Hey, Gozan, how are you? Glad you're back. Hey, Ami, how are you? I haven't been here for a while. I know it's been more than 2 weeks, and I've been extremely busy since I launched the community. I know I've been getting a lot of questions, a lot of requests in the community, and it's just stealing so much of my time. And I'm booked all day long with you guys. So it's been taking lots of my time and haven't been able to do much live. Would love to do lives every day, and I know TikTok and it's gonna be banned, so I hope everybody can actually move over to YouTube because a lot of the recordings do stay on YouTube channel, and we can continue doing the same videos on YouTube if that happens this Sunday coming up. It's good or bad to drink crushed garlic daily? Yeah, as long as you're not exceeding 3 cloves. If you exceed 3 cloves, you're gonna kill some brain cells. Your glasses, are they Daisy? What do you mean Daisy? I catch you live. Oh, hey, Kathy, how are you? What's your name on YouTube? It is under my name, full name, Maurice Daher. What advice do you give about undiagnosed palpitation as far as what test I should try to get? Check your vitamin D, check your RBC magnesium, check your homocysteine, and check your carnitine levels. Thanks. Developed an inguinal hernia, so I know the copper is probably helping 100%. And what I would do is look into peptides as copper, GHK, I think it's called. That be excellent for you. Thanks for those awesome information on Substack. Thanks so much, Gozan. I'm trying. There's a lot of information. I have like almost about 2 or 3 years worth of articles that I've handwritten over the years. And I'm glad I found Substack so I can actually start inputting all the articles. Sometimes I get bored, I put like 3, 4 articles in a day. Sometimes I put 1 or 2. Is eggs and bread good? Eggs are good. Bread, I'm not a huge fan unless they are sprouted and you're taking some supplement to kind of prevent the anti-nutrient effect. What's the community? I missed it. It's under my name, so it's mauricedaher.substack.com. I don't know if I can. Let me see if I can type. If I can type, I'm gonna write it here for you guys. Is honey good? Yeah, if you can get it raw. If you can get raw honey, unpasteurized, you can definitely take honey. Let me see if I can write it down. So it's Maurice Daher dot substack.com, and you can actually download this as an application as well onto your phone, so it doesn't have to be on a computer, guys. Honey and green tea is good. 100% is good. Yes. Honey and bread. Just make sure the bread is like sprouted. Probably would be best. So there you go. I just put the community name, guys. If you guys get a chance to go there and actually be part of it, I think would be great. In case TikTok goes down, would be excellent. But again, would love to have everyone move over to YouTube as well too, because I will continue producing I'm gonna go back and start doing daily videos there if TikTok is completely gone by this Sunday. Is Tatka good for cholesterol lowering? Tatka is good for your liver more than anything. For cholesterol lowering, not as much. I don't know why you want to lower your cholesterol. It's not about lowering your cholesterol. It's about kind of controlling your oxidation. What about sourdough bread? Sourdough bread is good. You still have about maybe about 50% less anti-nutrient effect. I was just gonna ask if you were moving. What do you think of Paul Saladino? Paul Saladino is okay. I think his mind is a little bit mixed between carnivore and fruits and you know, stuff like that. After years plus no sugar, I try to eat some muffins or chocolate, and I get sick feeling. Why? Because well, you become so tuned in with your body that when you try to introduce certain things, your body just reacts different to it, and you might not feel as good. And you know, these feelings, you know, that were hidden before because we used to eat them on a daily basis. Now when you actually introduce it once in a blue moon every couple of years, for example, it might make you feel sick, and your body might not tolerate it, or your pancreas might not even release the proper enzymes to actually break it down. And then you might feel down, or you might feel no good, or sometimes you might wake up feeling heavy anxiety the next day. What do you think of statins? I think statins are like number one poison to our body and brain and heart. And keep in mind, as a side effect, it does increase one of the genetic lipoprotein small a that could cause a stroke. White bread that had clean ingredients. Still, white bread is bread. Still has gluten. Still, the gluten is going to affect at least 80% of the population with their gut issues. You might not feel it right away in the first day or the first couple of weeks, but eventually it will get there. If you want to lower cholesterol, I mean, there's a lot of other things that would work a lot faster. You know, something like say niacin or bergamot or red yeast rice. What about almond flour bread? I think almond flour is man-made unless you're able to get like Spanish flour. They're fine, Spanish almonds, I mean. But it's better to stick with coconut flour, probably would be best, or probably use white rice instead, because the problem is with almond flour, it's very high in omega-6. So your omega-6 to omega-3 ratio is going to be off, and that's going to cause some pro-inflammatory issues in your body. Do you take supplements on a carnivore diet? Of course I do take supplements on a carnivore diet. Doesn't mean if you are on a carnivore diet, that means you don't need to take supplements anymore. Keep in mind, if you already live in a disease, it doesn't mean if you go on a carnivore diet that's it, you saturated your body with all the vitamins and minerals. If it took years to develop, it's going to take years for you to actually fix a deficiency. So it doesn't mean if you adapt on a carnivore, you're going to say, okay, don't be like these some influencers where they say, hey, if I follow a carnivore diet, I can throw all my supplements away. No, you can't. And it doesn't happen that fast. It will take years to fulfill these missing gaps. To give you an example, if your magnesium is low, let's say your magnesium should be optimally at 6 milligrams per deciliter, and let's say you do a blood test and it shows you're at 3 milligrams per deciliter, that will take you about 3 years to saturate your magnesium with taking a supplement, with being on a carnivore diet. So it doesn't happen overnight. I'm getting mushroom coffee on your website. Perfect. I just had a cup before I start talking to you guys. Yes, I get concerned about statin. They put my mom on them. Keep in mind, if she is on statin, make sure you increase her coenzyme Q10 and vitamin D, because they get depleted by statins. The red yeast rice in the USA has no active ingredients in it. Do you know of a brand that has it? Check the certificate of analysis. As long as it does not have citrin, because citrin is a mold toxin. All the red yeast rice, they all carry the 8 monocolins. So they cannot remove these monocolins from red yeast rice. There's no way they can do that. Can I add colchicine to the 4 heart meds post-stenting? You could, temporary. When I eat first meal and then drink coffee, things are okay with my gut thoughts. Yeah, but you're only feeling down when you're eating sugar, right? Not when you're eating like regular food, like say meat, for example. Can creatine increase uric acid levels in the body? No, it doesn't. Any studies on turmeric you know of? I've done a lot of research on turmeric. You just have to actually take a nano turmeric for it to actually absorb correctly in the body. I got sick around Christmas, and after infections, my blood pressure elevated both systolic and diastolic. Why? Because your body overuse your magnesium levels. Supplements to lower CRP. There's lots. There's vitamin E, tocotrienols, There's alpha lipoic acid, there's berberine, there's polyphenols. There's a lot of things can lower CRP. Is Mama Ramata healthy? Yes, and for vitamin D, maybe she can take cod liver oil. There's a concern about her taking K. What concern her taking K? There's no concern. There shouldn't be any concern. How to lower blood pressure? Book a time with me, guys. Let's talk about it if you want to know how to lower your blood pressure, and I can give you a full protocol. Thanks again for the D-ribose. It tastes so pure compared to the one I was using. Oh, okay. I'm glad you got it. Oh yeah, you got it last week. That's right. It is good stuff. I like it. And this is like the real patent design. They're the original company. And let me know how it feels after you start taking it. I take it daily still, and it's probably one of my favorite supplements that I will never stop from taking. Right now, I'm trying to actually get D-ribose in Bio PQQ. See if you can get a combination mix. It's just the Bio PQQ is way too expensive. Way too expensive. Daughter's lipase blood work score is 120, 18 years old. Overstimulation of your pancreas. I usually have 116 over 70. Lately it's been the 120s over 30s, diastolic 80s, 90s. What could I do? You have too much calcium in your diet. Check your RBC magnesium levels. Top 3 best supplements to take during high stress times: L-theanine, hesperidin, probably ashwagandha or lion's mane. But you need some your cofactors for them to absorb properly. Your cofactor is going to be your vitamin B complex. Hello, what is the criteria for a cardiac pacemaker? Does bradycardia with minor symptoms qualify for a pacemaker? I would not really put a pacemaker. You can actually fix bradycardia. Supplements for heart palpitation. I did an ebook on heart palpitations and bradycardia. They all fall under the same heart rhythm. They actually all fall into that same category where it causes 3 specific vitamins in the body that they become deficient. And it's not about just being deficient. There's actually an optimal level you have to be at. Best vitamin D supplement, make sure the vitamin D is mixed with MCT oil. I've seen a few people who's gotten sick around Christmas too. They say their diastolic is elevated. It's just probably the virus the government spray out there that it causes restrictions in your arterial system. There's nothing strange, Jay. You know, all the odds are against us. We just have to kind of continue maintaining our immune system good and continue maintaining our levels of nitric oxide quite good. What vitamin D do you recommend? I do have it on my website for the one I take. I take 50,000 IU of vitamin D3 every 3 days. The one I take, it does come with MCT oil mixed, but they only come in a 50,000 IU mix. Hi Maurice, as always, thank you for your work. What is recommended protocol for PQQ? Make sure you do take the Bio PQQ. It's the only non-synthetic version. It is very expensive, but that's the one you want to take. You can go as high as 20 milligrams. If you want to use it for therapeutic levels, 40 milligrams, but for a short term of about 30 days and drop down to 20 milligrams. The whole idea with BioQQ is all about biogenesis of new cells for your mitochondria and for your heart cells. So that's why I got some, but I'm mixing it with D-ribose, because D-ribose and BioPQQ, they both can act as biogenesis for new cells. So instead of recycling old sick cells, we can create brand new cells. Do you think egg whites can be eaten raw or just the yolk? Just the yolk. The egg white, our body cannot actually break down correctly. I was looking to take 2000 IU and vitamin D daily. No, you need more than that, Tin Man. It's all based on your body weight. You take 1000 IU per 25 pound of body weight for maintenance. Would you be able to help with this during a call? 100%. 100%, yes. Why can't I hold my stool? Too much magnesium or too much vitamin C. You're taking something too much of. Then you probably keep running to the bathroom and you're not able to hold your stool. And it just happens out of nowhere. And that's usually, it's either high levels of magnesium or high level of vitamin C that you're doing, or sometimes high levels of MCT oil. So these three things will actually cause your stool to actually pretty much you're not able to control it anymore. How much milligram Hawthorne capsule is a safe post PCI? 1500 milligrams. I got 6 times a day. Wow. I go 6 times a day. I need to know your diet. Like I don't know exactly what you're eating or what you're consuming and what you're taking for supplementation. For you to go 6 times a day, that's way too much. Obviously, something is going on in the gut. I hope it's not like H. pylori or anything like that. I'm 148 pounds. How much vitamin D you take? So every 25 pounds, you take 1000 IU. So let's say you're 150 divided by 6 by 25. What is that? 6000, I think, IU. I eat 6 or 7,000. I eat 4 eggs, 2 kiwis for breakfast. Why do you want to actually have kiwis in the morning and actually cause an insulin spike? There's no point. I would just eat the 4 eggs. No need to actually have kiwis in the morning. Hi Maurice, as always, thank you for your work. What is the recommended protocol? How much milligram Hawthorne? Okay, we've answered that. Which vitamin B helps support magnesium with palpitation? Vitamin B6. It's healthy. It's not about healthy, it's about spiking your insulin or not. Is that a safe amount to take, the 6000 IU vitamin D? Keep in mind, Tilman, I take 50,000 IU a day, every third day. So yes, 100% safe. On 75 milligrams Plavix, cannot take aspirin. What else to achieve the APT? I have to look at your information, like your record exactly, to see what's going on. The PCI, that's when they actually put you get in a stent. It's a non-surgical procedure. My doctor says that I have a risk of ulcerative colitis. Is it best to take D3 and K2 with butter or animal fat in the morning? I like to take the K2, the MK7 John at night, because K2 regulates calcium, and calcium is activated at night. So if you want to actually regulate your calcium better, it's better to take your K2 in the evening, which is your last meal. And of course, it is better to actually have it with animal fats because it's more bioavailable. And the vitamin D, I take it usually with meal 1. Just asking, I had quadruple bypass on 2012, was 43. That's why I ask about the amount of vitamin D. And the only reason you had a quadruple bypass is probably because due to a deficiency of 3 specific items in your body, and 2 of them are vitamin D and magnesium. So if you're not at 80 nanograms per milliliter for your vitamin D, and if you're not at 6 milligrams per deciliter or higher, then you are actually deficient, and that's why you end up having issues with your arterial system. Why is my diastolic pressure is always over 90? Because you have too much calcium, not enough magnesium in your body. Lipoprotein A is normal, lipoprotein B is high, CRP is low. So lipoprotein A is completely a different biomarker than lipoprotein B. The ApoB you're checking is called apolipoprotein B. And what you need to do is check your apolipoprotein A1. And when we do a ratio between ApoB and ApoA1, your ratio should be below, if you're male, below 0.7. And I think for female, it's 0.6 or 8. I have to check. I did a full article on this on my community, guys. If you go check it out and read it, would be excellent. Diagnosed with hereditary hemochromatosis. Should I take IP? You can take IP6. It does help. How much K2 with D3? K2, it depends. Like K2, you can get K2 from eating cheeses, from eating egg yolks. If you're just worried about having too much calcium, you can take 100 micrograms, which is fine. But if you're actually trying to treat a specific issue, like bone density, or you're trying to regulate your calcium better, I would say take minimum 500 micrograms of vitamin K2 MK7. How do you get rid of severe arthritis pain? Stop eating anything that contains oxalates and anything that actually falls in a nightshade, or anything that's actually causing issues with your gut. That's your first step before you start taking any supplementation. Can the vitamin D be taken without MCT? You could, but you still need some type of fat with it to be actually absorbed correctly. I like to take it with MCT because it is combined correctly if I'm gonna end up taking it on an empty stomach. The less fruit I eat, the better I feel. Is sugar that bad for us, whom are keto or carnivore? 100%. 100% it is, John. And I only eat like fruit on my carb day, once a week. And trust me, the day I do that, every Saturday evening, I wake up on Sunday feeling groggy, feeling tired, feeling anxiety. And I know for a fact that happens from eating the carbohydrates. And the only reason I do that just so I can refuel my glycogen storage. If I didn't really care much about the glycogen storage, I wouldn't even do it. I take goat milk powder sometimes a few times a day with goat whey. I make sure I take K2, D, and mag. Okay. If you like some processing stuff, it's fine. How can I take care of psoriasis, arthritis? Stop anything hormonal foods. But get yourself some suet, melt it, and actually put it on your skin so you can actually allow your skin to heal better. Triglycerides, A1C 5.7, but higher random glucose is about. Well, the A1C 5.7 I don't like. It should be at least 5.1. I take D3, K2, magnesium, tocotrienols, and neurokinase. Is there anything else can unlock arteries? You're missing lumbrokinase. You're missing serapeptase. That's like your most important. You're missing some EDTA to actually chelate down, so you can actually cause some chelation for the calcium. Where can I sign up to do a consultation with you? Ray, if you go to my main page or the website, which is stan.store/Maurice Daher, that's my main website, and you can book an appointment there. I've been getting acid reflux every day now. Throat been burning. Any suggestion? Yeah, you don't have enough acidity in your guts. What carnitine does, it has a lot of good benefits for your heart, for your mitochondria. It takes the fat and actually turns it into energy for your heart. Foods high in magnesium. We don't have many. We don't have many at all. It's best to actually supplement. We used to get magnesium from our drinking water. What did you say I have to melt for psoriasis? Get some suet or beef tallow and actually rub it on your skin where you have the psoriasis. Give me a second, guys. ليه عم تعيطيله؟ أنا برا؟ عم بحكي على التليفون عشان عم تحشر فيه. Had to check on Duke. What did I miss? What can I take? ACV? Yeah, you can take 1 tablespoon of ACV at least 15 minutes before you eat your meal, and I would take some hydrochloric acid as well too, so you can increase the acidity. The more acid you have, the less chances you're gonna have H. pylori, the less chances you're gonna have heartburn, acid reflux, the less chances you're gonna end up allowing pathogenics to actually thrive in your gut. So hydrochloric acid is very, very important. Or acidity in your gut should be 1.5 to maybe 2.5 at max. D-ribose is excellent for your heart. Make sure you get the bioenergy patent version. How good is EGCG in green tea matcha for cardiovascular health? It's a polyphenol. We need at least 1700 to 2000 milligrams of polyphenols daily. The last video I did on polyphenols, the one that I currently am getting and I used to take, I explained what each polyphenol does to the arterial system. So definitely watch it. Can lumbrokinase serapeptase be taken every day? Currently on 12,000 fibrin units of neurokinase. Yeah, you could take them every day. But neurokinase, you should cycle it every 90 days. And when you get off of it, you have to wean off of it. You cannot just drop it instantly. Can leaky gut be healed naturally or only with antibiotics? Antibiotics are garbage. Antibiotics do not heal leaky gut. Antibiotics will actually suppress your gut and hide the symptoms, but it does not go after the root cause. Jay, or would that need a longer conversation? What did you want to talk about? I can tell you exactly whether you need 30 minutes or an hour. Should I cycle iodine and boron? I do cycle iodine. I don't cycle boron. Iodine, usually I go at least 120 days and I take a week off. Just to kind of keep an eye on your thyroid, especially your reverse T3. Can proteolytic enzymes like neurokinase, serapeptase, and bromelain taken to reduce plaque damage, healthy heart tissue if blood levels are too high? The thing is, they do work. The problem is you have to go take them consistency for many months or many years, and the problem is a lot of them don't even carry enough enzymes in them, enough milligrams. They're way too low. Elevated blood pressure after getting sick from the fog or whatever they sprayed in the air. Blood pressure is elevated. Yeah, a good. If you want to take notes, it would be a good 30 minutes. If I'm going to take notes and write you a protocol, then do a full hour. A1C 8.3 on metformin. Glycoside can't lower after exercise. Can't lower after exercise. You will never be able to lower it with metformin if your diet is not being fixed. But keep in mind, if you are losing weight, that weight has to be filtered somewhere too. How to put MS into remissions naturally? We'll have to talk about that because everything has to do with your lifestyle. Is sodium bicarbonate good for kidney issues? Yeah, you can use it. I would use NMN and TMG if you have low filtration in your kidneys. Yes, I take natural capsule with essential oils for my immune boost. Perfect. Any chance to get off meds 1 year after 2 heart stents? Oh, you could get off of them within 30 days. I was off of them within probably about 30 days. Off everything except one. Usually the only one you have to be on it would be like Brilinta or Plavix until the stent is actually stable. Vertigo, there's an exercise for that. That's Duke going crazy outside because we have some coyotes been coming in for the past few days here in the city. It's kind of interesting. Guys, you all aware that TikTok is gonna, for you guys in the USA, is gonna stop working this Sunday, I think. So are you guys gonna join my YouTube channel? Or what's going on? I need you guys to be there so we can continue doing these lives. I want to switch all you guys from TikTok over to YouTube. Is there a way to remove existing plaque in arteries? Yes, 100% there is. After 39 years of eating junk, it took over a year to heal that gut. 100%. 100%. It takes, trust me, and sometimes some people it takes even longer. So I'm glad you're feeling much better, John. How can you lower ALT and AST, the enzymes in your liver? If they are overstimulated, the question is, why are they overstimulated? You have to look at your lifestyle and look whether you're taking any medications or not. What's your YouTube? It's under my name, Maurice Daher. Can I consult with you? Yeah, if you click on my profile picture on the top, guys, it'll take you to my main page. On the main page, there's a website. If you click on that website, you can pick a 30 minute, you can pick an hour. I think TikTok is extended. I don't know if it's extended because they just sent me an email that by Sunday is gonna be shut down. John, cheers, thanks so much. Guys, if you join even the community, because I'm gonna start to host a lot of private videos in the community as well too. Are statins safe for long term? I take rovastatin for over 4 years. Statins, the only way they could be safe if you're taking minimum 10,000 IU of vitamin D and at least 300 milligrams of coenzyme Q10. Other than that, they're not. But long term, they will cause some brain damage. take Zatia and Crestor, can that cause high level of enzymes in the liver? Oh, 100%, yes. They both actually get converted into the liver, nothing to do with the kidneys. So yes, that's why your ALT and AST. So that's why usually the doctor will actually, they do like a 3 months checkup on you, and if they see that your liver enzymes are elevated, they usually lower your statin medications, and they have to. Is a calcium CT scan worth it? No. If you want to get something done, Becky, look for CCTA scan. The CT scan only scans for calcifications. The CCTA scan scans for calcifications and soft plaque. What dose of serapeptase? 500,000 SPU a day, split into 2 doses. Nerokinase 12,000 split into 3 doses. Lumbrokinase 40 milligrams. B, supplement for small blood vessel disease. I would take nitrate, because nitrate has the power to actually release EPCs. Been drinking a lot of goat milk and feel great. Is the goat milk raw? I would love to get some. Maurice, what is the peptides again possibly helping for hernia? BPC 157, TB 500. Bisoprolol beta blocker for high blood pressure. I take it at 9 a.m. daily. Is that a good time? It's temporary until you fix your root cause. And I would actually highly recommend fixing the root cause. How to remove existing plaque? Oh, there's a lot of ways to remove it. I cannot just give you an answer just like that, Jeff. You have to actually, I need to know exactly your background, your history, your lifestyle, your intake of food, because all these will actually, whether they'll cause a progression or whether we can stop the progression and allow for healing. But if you look at one of my video on YouTube about Cavadix, so far we've been having some good success. We're just waiting for some more testing. What are sources of nitrate? There's only 2 companies out there that make nitrate that they actually can last in your body up to 8 hours. One is made from arugula extraction, is patented, and the other one comes from beets, 25% extraction, and as well as patented. Because if you just get a regular beet powder or regular arugula powder, they only work for about 6 seconds. I have goat. I have plenty of raw goat. Oh, nice. Katharina, I'm gonna come over and buy a couple goats from my land when I go off the grid. Where are you at? I'm in Canada. It's probably be a long drive. Erectile dysfunction, boron, 53-year-old male. Yeah, and I would actually get some infrared light, something like that. And I would shoot it on the man parts for at least like 6 minutes every other day. That will actually increase nitric oxide levels as well too, which works really, really good. I looked up your name, and bro, your name is all over the place. Great to see you live. I hope you and Duke are doing well. Pete, thanks so much for the support and the donation, and really appreciate it. We're doing fine, and Duke is just outside having some fun. He'll be here soon. But I really appreciate your support. It means a lot to us. I don't know how else to thank you. I hope you're doing well, and hopefully this year is turning out to be quite successful, health-wise and business-wise for you. I'm in West Massachusetts. I would give you a goat breeding stock if you want. I wonder how far you are from driving-wise from Canada. If I go to your place, and let's see. To BC, Canada drive. It's probably a long drive. Oh wow, 4,000 kilometers. Do you have a regular lifetime? I'm gonna try to do it every night, Jeanette. I'm trying. I know it's been a week and a half, and I've been trying to promise, but I've been getting booked. But I want to do it like in the evening, and I hope if TikTok is banned, that you guys can move over to YouTube, because I'll be continue doing it on YouTube as well too. Hormones does affect on mental health, especially it depends what your thyroid is up to. That's a long drive. Yeah, it is. Can you give advice for someone who has post-concussion symptom? I'm just gonna look at my cheat sheet if I have anything. From a car accident, like the only thing is keep in mind when you are into an accident, and what happened is like say whip clashes, because I've been there. I've had that almost 15 years ago, and almost not 15 years ago, back in 2000 that happened to me. And you should never really ignore it, because when you actually get hit in an accident and you get whiplashed, symptoms do not show up right away sometimes. Sometimes you might get like a joint pain, neck dislocations, shoulder dislocations, stuff like that. But there's arterial system that could actually get damaged, or capillaries, or if your nerves or your arteries are actually weak, they can actually be damaged, but they don't show up till at least 90 days or 6 months after. So I would highly recommend taking omega-3 at least 4 grams a day, 2 grams in the morning, 2 grams in the evening, because that's the first thing to actually control inflammation in the body. I would take magnesium ionic chloride. I would take vitamin D3 as well too, and make sure your vitamin D is at an optimal level of 80 nanograms per deciliter. And I would actually take nitrate, because you want to actually vasodilate your arteries so you continue getting blood flow to your system, because everything is tensing up in your body right now. You cannot feel it, but everything is tensing up in your body, and I just want to make sure there's no long-term damages are occurring. Can you get you into lecture all the senior cardiologists in Alberta? Can we get you in a lecture? You should do it in Alberta. I'd love to see you debate with Dr. Mine specifically in the USA. I had to actually have a discussion with a few doctors for some of my patients last week. It was kind of a little bit brutal, but they're so hard-headed, and sometimes, I start to laugh on the phone a little bit, and it's not a good sign for me to laugh. I should just keep it professional, but it's just some of the stuff they say is just funny. CRP is always high. Jeanette, we have to look into that. It gotta be something you're either doing to your body or something you're consuming. But one of the best things to do, I'll tell you what you can do. So you can take omega-3s, it's gonna help you. You can take, what else can you take? You can take curcumin, you can take quercetin, you can increase some polyphenols into your diet. NAC specifically is going to actually reduce your CRP. I take a lot of high levels of NAC, and my CRP is always at 0.4 or 0.2. And try not to eat anything that actually tends to ferment in your gut. So keep it as simple as possible if you get a chance. Holy basil supplement, how and when to take it. It has to be, because it's considered to be a polyphenol, John. So it has to be with some type of rich oil. Please check out Biofix brand. Okay, let me look this up. So Biofix brand. They have K2 MK7 300 micrograms at good price. I would like your thoughts on the quality. Biofix vitamin K2. I'm gonna check. I'm just gonna put a note here, Pete. Give me a quick minute, and I'm gonna look it up. So Biofix brand for their vitamin K2. Vitamin K2. Biofix. Okay, there you go. So I'm on their website. I'll check it out. I won't be able to give you an answer right away, but I'll have to dig into it a little bit more. So they are using MK7, soy-free. Let's look at the ingredients. 300 micrograms. That's really good. Microcrystalline cellulose from silica. So it's not mixed with any type of oil then. It's just pure powder form. You know, the one I take, Pete, is, I don't know if you guys can get it in the USA. I wonder if they can ship to the USA or not. The one I take, let me grab the one I take right now. So this is the one I take, Pete. It's by Canprev K2. Now, with this one here, the one I currently take, you get 120 microgram per capsule. Of course, I take 5 a day, one meal. So this one is 300 micrograms. But this one is actually is mixed with MCT oil. So they have it organic, virgin coconut oil, medium chain triglyceride, about 75% medium chain triglyceride, bovine, purified water. Okay, I'll check the one that you actually sent me. I'm kind of interested because it is 300 microgram per capsule. So instead of me taking 5, we can look into that. I'll just have to check their certificate of analysis to make sure it is coming from a good source. I'll dig into it. I'll dig into it and I'll respond to you on one of the comments and stuff. Cayenne pepper powder good to clean arteries? No, it doesn't clean arteries. Cayenne pepper is just a flow. It just allows proper flow. Cayenne pepper was almost, if you guys read some information on cayenne, it was actually used by Dr. Schultz, I think, or I can't remember the exact doctor. They only use it to actually prevent a heart attack, but not to actually clean arteries. It doesn't have the capability. It just opens up the blood flow, allows more blood flow. And if you take too much of it on a daily basis, it could cause hemorrhoids. There is no real information could be hidden. I can't really say for sure. Information could be hidden, but it will improve like the blood vessel vasodilation. So it's almost like a nitrate, and it does actually reduce some systemic inflammation. It does act as a driver, but you have to be taking at least 40,000 to 90,000 heat units. Yeah, Dr. Schultz, Dr. Richard Schultz. So when he used cayenne, he was mostly using it to actually prevent a heart attack or prevent a stroke, for example. But keep in mind, if you want to take it on a daily basis, if you're going to be taking 40,000 heat units, you can actually take 1/4 teaspoon 3 times a day. If you're going to be taking 90,000 heat units, you shouldn't be taking no more than about 1/4 teaspoon once a day. I've done all the testing on it, and if you take 90,000 heat units or more, then what's going to happen is you're going to end up getting some hemorrhoids. So to prevent hemorrhoids, you can take diosmin, you can take hesperidin, you can take rutin to actually strengthen the arterial system, so you don't end up causing any damages to your system. So that would be great if you want to do it that way. But if you can find 1 million heat units, then that one would actually work a lot better as well too. How can I reduce blood sugar in my body and cholesterol? It's all about what you eat. So anything you actually consume, you're either gonna feed a disease or you're gonna prevent one. And obviously, you cannot just say, well, how can I reduce my blood sugar if you're not gonna actually change your lifestyle? So there's no such thing as a supplement being magical. You can take a supplement and you feel great. You actually have to work with it, and you actually have to fix your lifestyle as well too. DMSO, I did a video on that, so if you want to check it out, I have a full video protocol on YouTube as well too. Can you please share your thoughts on berberine? Berberine is actually good because other than the anti-inflammatory, antifungal, it does actually reduce the calcium deposits in the arterial system. The only thing is you have to cycle it, or it can cause some digestive issues. So it's good to cycle every 45 days, at least 5 days off. Hey Mo, I took 500 milligrams of NAC per day, but it made my chest feel very raw. Maybe conflict with heart meds? It shouldn't. NAC should not conflict with heart meds. It depends. Like, are you talking like a blood thinners? Are you taking it close within the specific timing? Like, I take 2400 milligrams of NAC 3 times a day. And a lot of my patients, they take quite high dose, and we cycle it 5 days on, 3 days off. I haven't seen anything that causes any issues unless you're taking it too close within a 4-hour range of your, let's say, blood thinning medications, possibly. If you give me the name of the medications you're taking, well, if there's only like 1 or 2, but if there's too many, I won't be able to actually check right now. Have you heard about CiO2, sodium chloride and hydrochloric acid? Yeah, I've heard of hydrochloric acid. How else we gonna increase the acidity in our gut? Guys, give me a second. I have to open the door for Duke. Maybe Duke will join us soon. How is Duke doing? He just came in. He's been outside. Let's see if he'll come up. Hey, Duke! Maurice, for the peptide, it's PPC. It's TB 500. Is it extremely cold? It's supposed to be -20 this Saturday, but today it actually was +7 degrees, so it hasn't been that bad. Weather kind of fluctuates quite a bit here in the city. Yeah, it is nice and warm. Usually it's gonna drop to -20 this Saturday. Probably it's gonna be -20, -15 all the way till about Monday. Then it might maybe get a little bit nicer. So it's not bad. A little warmer in New York. Just watch your video on collapsed vein. Which root 500 grams are you talking about? Just watch your video on collapsed veins. Which one? Are you talking on TikTok or are you talking on YouTube? Which video did you watch? I put so many videos, sometimes I forget, so you have to sometimes remind me. When you said cycle off neurokinase slowly, what happens if you just drop? Sometimes certain individuals end up getting some inflammation because it is a blood thinner, right? So a lot of blood thinners, you should not just completely drop. You should always kind of wean off. So if you're taking 12,000, you cut it down to 8,000 for 3-4 days, and you go from 8,000 down to like 4,000, and down to let's say 2,000. It depends what kind of capsules you get. Like the capsules I have, they're 4,000 fibrin units each. So every time you want to get off, you should actually get off slowly the last week and a half. Yes, on TikTok, 500 milligrams. I keep missing mine. I've got pneumonia. What was the video called? Was it about the vascular stuff? Oh, the screen froze. You keep missing mine. I've got pneumonia. Well, you can do, what else can you do? I would actually start with NAC. I would go anywhere between either 1,200 milligrams on an empty stomach. I would go 3 times a day, 5 days on, 3 days off, see how you feel. And I would do either, you can do 2,400 milligrams, 3 days on, 2 days off. You should cycle Nero. I did a video on it, why we should cycle it. Just gonna see if I have it on my cheat book. I'm trying to actually put a lot of that information within the community and stuff. So I'm just gonna pull up the one I made for myself, the one I take. So what I do is I go 12 weeks on, 2 weeks off. That's how I do it, how I kind of do it with neurokinase. So when I go 12 weeks on, 2 weeks off, on the 11th week, I cut the dose by half. Then the last day I cut it by almost another 25%, and I'm off of it for 2 weeks, and I kind of go back on it. So that's usually how I cycle neurokinase. And I don't know how much dose you're taking, Pete or Ami. I take roughly 12,000 to 16,000 fibrin units. I'm increasing my intake of taurine from 4 to 6. Are there any side effects with it? No side effects with taurine. I've taken as high as 100 grams daily for 18 days straight, so there's no side effects at all. 12,000, yeah. So you're probably taking 4, 4, and 4, right? 4, 8, 12. So you can do, so if you're doing a 12 weeks, on your 11th week, cut down the dose down to 8,000 for 2-3 days and 4,000 for the rest of the 4-5 days and stop. That's usually how I do it. Does low testosterone cause weight gain? And yes, and you're probably more estrogen dominant. 8K fibrin units in the morning, 8K at night. Okay. Oh, you're taking 16 as well too. Okay. Yeah, you can just do it. I like to see, like, I don't really cycle everything. I only cycle like a handful of supplements. So I cycle my berberine, I cycle my neurokinase, I cycle the lumbrokinase, and what else do I cycle? For supplementation, I'm trying to think. That's the only ones. The only supplement that I've been taking for 10 years straight is actually nitrate. That one I have not stopped. But most of the supplements I do cycle. Vitamin K2, MK7, I don't cycle it. I've been on it, that high of a dose, for probably a good year straight. Niacin is good to control your lipids from oxidizing. Does it have cleaning arteries? If it's mixed with vitamin B1, it could have some good potential. And it just reminded me I should take mine. Let me take 1,000 milligrams right now. Sometimes I forget to take my supplements until you guys remind me. So I'll take 2 of them. We'll see if I get any flush. Your veins are collapsing and you can't even feel it. Is that my latest video that I put? Send me a direct DM, I'll check it. I think because I did say 500 milligrams of rutin and hesperidin and diosmin. Is that the one I was talking about? For varicose veins? I can't believe how much information you have in your brain. It's all in here. I need to actually, I've been forgetting a lot of things because I haven't been using it for so much. And right now I'm glad that I'm actually putting it in the community, because I have like 2 years worth of stuff that I just want to keep writing and put it. It's so much time consuming, but it's going good. The cardiologist told my husband niacin is bad. They've been trying to destroy niacin for the past 60 some years. Good evening, long time. Hey Ziggy, how are you? I hope you're doing good. What is L-glutamine good for? It's good for the gut. Some people like it, some people don't. I don't like it myself. Some people love it, but keep in mind, you have to use, a good amount of it to actually feel it, or best to actually mix it with other supplements. How much lumbrokinase is recommended if you already take neurokinase? I take 40. I take 40 milligrams. I haven't tried taking any higher. Lumbrokinase. I don't know if Pete is with us online. I don't know if he's taking lumbrokinase or not. I'm taking 40 milligrams, but I haven't tried any higher yet. So rutin, R-U-T-I-N. It's So think of it like not a polyphenol. Yeah, you can say maybe like a polyphenol antioxidant. No, sir, I'm not. Okay. Yeah, the lumbrokinase, the highest levels I'm taking is just 40. I haven't taken any higher than that. When you take nattokinase, you don't have to take lumbrokinase. You can take either or if you want, because they both do the same thing. Does anything help wall thickening of the heart? There's lots you can do. There's lots you can do. But it's probably best to kind of book a time so we can talk about it. What's good for severe back pain? Are you working out or anything? Or you're doing some exercises or movements? Or are you sitting idle? There's a lot of things to look into. Abdullah, how are you? How do you take that one? I saw it on the H. pylori protocol. Is that the one? Oh, the one I put out? For which one? For glutamine? What's your thoughts on all the GLP meds? They're okay. Movement is worse. The name with the S. The name with the S? Oh, you mean serapeptase? You can take it on an empty stomach. You're not supposed to take it with food, if that's the one. Is that the one, Ziggy? I had bypass, yeah, serapeptase. You take about 250,000 units twice a day. That's about 500,000 SPU. I had bypass surgery. What do you recommend I take for life? I would say you take nitrate. If anybody had a heart attack or a stent or bypass or quadruple issues or whatever it is, one of my first to go supplement would always be a nitrate supplement, which is the nitrate supplement will activate your nitric oxide pathway. The only reason, see, there was back in the early 90s, there was a Nobel Prize that was won by 3 doctors. They claimed in the presence of nitric oxide, a person should never have a heart attack. So if that's true, that should be one of our most important supplement to be consumed at all time. And that's the only reason I've been taking it for 10 years. The only thing is you cannot just take any type of nitrate powder out there, because if they're not, they have the proper percentage extracted for the nitrate, then you're defeating the purpose. So for example, if you go buy a beetroot powder, well, beetroot powder, if it doesn't have anything stating how much extraction of nitrate is in it, you will have to consume 300 grams to get the benefit of 500 milligrams of nitrate. So there's only 2 companies out there, and I have both of them on my website, because one they actually use the beetroot extraction with potassium nitrate, and the other one they use arugula. Because once you hit over the age of 40, or once you've already lived with a heart disease, our bodies cannot convert the usable amino acids we get from food into proper nitric oxide. I hope that makes sense. Would garlic daily sort of help with nitric oxide production? Yes, it does, mostly for induced nitric oxide. So INOS instead of ENOS. ENOS is more endothelial nitric oxide. INOS is more inducible nitric oxide. So it's more of the immune system nitric oxide boosting, because you have INOS, ENOS, and NNOS. I ordered 5 bottles of nitrate using your code. Awesome. Hey, thanks so much, Pete. Let me know how you like it. We finally got it approved for Canadians as well too, so which is excellent. But I take about 1,000, sometimes 1,500 milligrams of nitrate a day. I'm trying to actually get a blood test so I can check my EPCs level, so I can hit roughly about 3,000 EPCs daily if I could. I started B6, B12, and folate because I'm taking 500 milligrams of niacin daily. Or you can just take TMG, trimethylglycine, to help with the methylation. Because niacin does kind of conflicts with with some of the methylation issues. My fractures on being an athlete. Finally diagnosed myself when had chest pain and legs wouldn't Tap prescreen 15,000 milligrams vitamin D3 without K2. Is this safe? You mean 15,000 IU, not 15,000 milligrams. Yeah, that's fine as long as you're not going over your optimal level, which is 80 nanograms per deciliter. Hypercalcemia for years and didn't know it. That's crazy. It's probably all started with your thyroid. What about chlorine dioxide? What do you want to use it for? Does your doctor ask you for advice? My doctor, I haven't seen my doctor for like 3, 4 years, to be honest with you, even longer, probably 5 years. We actually just talk over the phone. I tell him what I want over the phone, and he just sends me the information. And now I'm trying to get a CCTA scan done locally here. They're gonna charge me $1,400. It's freaking expensive, but I need to get it for the CCTA doctor, for the CCTA scan. But now there was a waiting list for like 15 days. But now because waiting for my cardiologist, he wants to see my blood work first, which is I don't like him much. Then he wants to actually send me to get the CCTA scan, and now they put me on a waiting list for 5 months. But I'll be gone off the grid again, so I'm trying to actually speed up the process, and hopefully I can get it. Even thought I'm paying for it because it's not covered by insurance or by our Alberta healthcare. So hopefully they can get me in right away so I can do the scan. I just don't like the idea of getting the dye because they put that dye so everything brightens up in your arteries and everything. You're my doctor. Sounds good. 98% of all disease known to man. Um, you don't like your cardio? I don't like my cardio. Well, it's funny. My cardiologist, I don't agree with him. He doesn't agree with me. And the funny thing is, when he sees my numbers and everything, we sit down and we argue about it. He sees me like once every 2 years. And it's funny, now he's under so much stress because he has cancer. And keep in mind, he's been taking statins for 17 years. And every time, I go see him, I'm like, hey, you should change your diet. We can do this, we can do that. And now when I saw him 2 years ago, he lost his hair and everything because he's doing chemotherapy because he has cancer. Now you wonder, why does he have cancer? Well, the only medication he's been taking for the past 15, 17 years is statins to control his cholesterol. But yet they don't actually take into consideration, hey, maybe I should change my diet, or maybe I should do something, or maybe ask yourself, why do I need statins? Like, well, my heart is healthy, I don't have calcifications or nothing, but yet I have cancer. So explain that. And you wonder if it's the statins that caused that. He's been taking it for 17 years. Keep in mind, when you guys have low cholesterol, you could possibly have a higher risk of cancer. In the USA, a CAC scan is very cheap, 100 to 200, because they want to get you on a statin as soon as possible. That's crazy, $100, wow, compared to us here in Canada. So it's cheaper for me to drive to the USA, get my scan done, and come back. It's crazy. It's just I don't have a place to leave Duke, and I can't cross the border with Duke because he's not vaccinated. Now they have a new law; they won't allow me to leave with Duke. Talk to your messages are being banned for some reason. Dr. Andreas Ludwig, video on blood with chlorine dioxide and BMAs. I'm gonna look that up. Talk 77. I like what you said. Whenever you guys put something interesting, I like to actually research it. So before I lose that message because it got banned for some reason. Dr. Andreas Ludwig. I've heard of Dr. Andreas Ludwig. I just wanna check out the video about chlorine dioxide. I'm gonna look into it, and if I like it, maybe I'll do a video on it this Friday on YouTube. There's way to reduce the lipoprotein. Yes, there is, 100%. Chlorine dioxide testimonies on Telegram. Hope this goes through. I'll check it out. I'll check it out. I'm kind of interested to kind of know a little bit more about it. I haven't looked into it much, but I'll definitely check it out. And maybe if I put a video out, it doesn't get banned or anything like that. It shouldn't. So what's the deal here? So we're losing TikTok this Sunday. So if you guys are losing TikTok this Sunday, I need you to all move over to YouTube. What is the safest way to lower potassium? Increase your magnesium. Your magnesium will actually stabilize your potassium. But probably when you're testing your potassium, you're testing the incorrect version. You have to test for RBC potassium, not serum potassium. What clears plastic from the body? I don't know. Maybe zeolite could possibly do it. I had a CAC, CIMT, and an ABI 3 years ago. Everything was normal. That's awesome, Pete. 100%. That's great to hear. I'm glad everything is excellent with you. I know you were taking the other nano product. I'm actually gonna be starting this on the 1st, so looking forward to it as well too. That'll be interesting. Gotta take 8 capsules every night. What about the blue methylene? I see. The blue methylene stuff is good. The problem is you have to be careful because it can kind of damage some of the items or some of your mitochondria. If you use it in a small dose, it's okay. But you'll have to actually be careful. I wouldn't really recommend it for like a healthy individuals. I would probably, if anybody has sickness or sick, or they have cognitive decline, or their mitochondria is not functioning, then yes, it could definitely help. But if you're like a healthy person and you have good mitochondria levels, I wouldn't really recommend it. Low carb, low stress lifestyle helps a lot. Oh, 100%. I 100% agree with you on that. Arterial stiffness is reversible, yes. Methylene blue does contain too many metals. That's the thing, is like there's so much hype about it, people are talking about it, but the problem is nobody's looking into it in depth, and that's the problem. Oh, you were using it. Okay. Yeah, you have to be careful. If you ever want to use it, it's like almost like a temporary thing to see what it does or how it works, whether it's gonna actually benefit or not. It's a hit and miss. I wonder if TikTok will allow me to send you a DM, PM with a link to that video. They hate the truth. Send me a try. I know sometimes they get blocked, but try it out. I read the cacao can help with the stem cell growth. I take a straw as a cacao drink. It's bullshit. You think you believe that it helps with the stem cells? There's no real proof evidence behind it of how much percentage it increases with the stem cells. If you want to actually increase your stem cells, one of the best thing to do is eat raw bone marrow. What benefits does blue spirulina have, and what's the proper dose? I don't really believe or take or use spirulina at all. So it's like a health fad, yes, like anything else. There's new things comes out, people talk about it, they just throw it on TikTok, throw it on a lot of influencer channels, and they get people excited, they get people hooked to it, but not many people are doing much reading or research on it, and sometimes it can cause more harm than good. And some of the stuff could actually cause some major side effects as well too. Cacao does taste good, just keep in mind that it's very high in oxalates. Hi, doctor, my blood pressure is 140/60. Can you please explain? You have too much calcium, not enough magnesium in your body. Very simple. So think of it this way. Calcium contracts and magnesium relaxes. So when your systolic is high, that means you have too much contraction, not enough relaxation. So that's like the clue that I gave you. That means you have too much calcium and not enough magnesium. That means you're deficient in magnesium. What causes extremely low triglyceride by high? That's interesting. What causes extremely low triglyceride but high blood pressure? but they both have nothing to do with each other. Low triglyceride is all due to how much carbohydrates you consume or not, and sometimes how much fats you consume or not, because triglyceride, think of it as an energy where it's actually being stored for later usage. And both fat and carbs, they're both used as energy. And if you don't actually utilize them, they get actually stored. High blood pressure, the only reason you end up having high blood pressure has nothing to do with your triglyceride. It has more to do with your blood flow and a deficiency of vitamin D, magnesium, or whether you have the gene or the homocysteine not converting correctly to methionine, for example. That's the top three. If everything is good, then it all comes down to your kidneys, but nothing to do with the triglyceride. How much magnesium should we take? Anywhere between 400 to 1200 milligrams daily. Seriously, that's how much magnesium we're deficient. What's the best supplement to lose weight? Stop eating carbohydrates in your diet. Stop eating anything processed. Stop eating anything that has seed oils in it. It's not so much high calcium that means you ever have enough magnesium in your body. Before you blame the calcium, blame the magnesium not being sufficient in your body. What's good number for triglyceride? The best way to do it is take your triglyceride number divided by your HDL, and we like to see, an average below 2, but for optimal level below 1. What do you think of the carnivore diet? I've been on the carnivore diet for 10 years. What would you like to know? I only use grass-fed and pasture-raised ghee for all my cooking. Great stuff. Fourth and Heart brand. 100%. I really appreciate you sharing that. No, that's the best way to do it. Grass-fed, grass-finished, pasture-raised, wild sockeye salmon if you eat any. And, use as much animal fats as you could. I know some people, they like to use coconut for cooking, which is okay. But animal fat's still one of the best. Now, the only downfall is some people who actually has already a stent, then it becomes more of an issue where they have to kind of watch of how much saturated fat they have to consume. That's the only thing. But anybody who doesn't have any heart disease, if they can follow that diet, way before what happened would have been amazing. Is there anything that improves mitral valve regulation besides magnesium? Yes, you got D-ribose, you got L-carnitine, you got ubiquinol, you got cod liver oil. Good night, everyone. Happy New Year. Same to you. Grass-fed is perfect if the land hasn't been poisoned. That's perfect if the land hasn't been poisoned. Maurice, thanks for PG reference varicose veins. There's some confusion about soups. What's root 500? Rutin. R-U-T-I-N. I think that's what it is. Love Corella. Your thoughts? Corella is good for detoxification. It's excellent. Maurice, I had a gout attack this past weekend and I got a cortisone shot on my knee yesterday. Should I stop eating red meat? I normally eat brisket from Costco. Are you eating anything else with it? I would actually just reduce the amount of fat a little bit from the brisket. Should be fine. But the red meat has nothing to do with your gout. I know due to the issue you've had before. Just reduce the fat slightly, because I know the brisket is quite rich. And I know you sent me a picture, Abdullah. You were doing your magnesium therapy that we talked about, the IV therapy. How's that going? High cholesterol in our genes. How do I normalize it? The only reason it is high, only if you're a hyper responder. That's like less than 1%. And what do you mean? What is high to you? It went well. Oh, I eat the fat at all. No, no, you eat some, but don't overdo it. If you are ever in the greater Houston area for any reason, send me a text. Oh, I will, 100%. I wanna actually start next year. Next winter, I wanna actually do some traveling to the USA if I could. If I can get one of my local vet to kind of say that I did vaccinate Duke, I'd love to come down to the US. So this way I can take him with me because I don't know where to keep him here by himself. This way I can do like a small tour or something. So I'm invited by Ziggy to Boston. I'm invited by Pete to Great Houston. I got a lot of people inviting me left and right. So I'll spend probably the next 3-4 months just visiting everybody. It was great, thanks, and I'm taking our magnesium now. Just make sure, because you did the magnesium IV therapy, don't take too much of the magnesium liquid for at least a day or two until your body settles, because you don't want to end up causing any soft stool effect. I'm inviting you in Minnesota as well. We got Minnesota and North Carolina. I'm gonna have a huge list to actually start driving. It'll be a lot of driving. But my blood pressure is normal. Where the blood pressure has nothing to do with your cholesterol. I take magnesium glycinate, but it gives me loose stool. You're taking too much, your body's not absorbing it. 90 triglyceride divided by 45 HDL comes out to 2. Is that okay? It's not bad. It's average. It's average. If you can actually reduce your triglyceride slightly, would be excellent. So keep in mind, triglyceride is energy. The energy comes from either your fat intake or your carb intake. So let's say if you're consuming 100 grams of fat, let's say, but your body's only utilizing 80, you have 20 grams being stored for later usage. So if every day you're consuming the same and every day you have 20 grams being stored, so that's why you tend to see high triglycerides. You're welcome to Vancouver. Vancouver is going to be easy. That's going to be like a 10-hour drive from my BC location off a grid. I come to Toronto every spring break. I drive from Minnesota. How many hours is that? Well, you're up off east. You're the opposite. If I want to fly to Toronto, that's like a 6-hour flight for me. Sometimes my cholesterol goes up to 300. That's all based on what you're eating. I'm a 53-old female, had vasectomy at 38 plus gallbladder removal. That's not good. You're more than welcome here in Chicago. That's awesome. I gotta write down all the list and start doing like a planet tour for next year. Is ascorbic acid vitamin C worth it? Yeah, works not bad. You need it, still need it. Unless you can do like your own liposomal. I think maybe I should actually teach you guys how to do liposomal in one of the videos. Maybe I'll get all the ingredients and do like a liposomal session. Because anything that is liposomal or anything that is enema is gonna be much healthier, or our body's gonna actually absorb it a lot better than just taking it as a regular pill and going through our massive acidity level in the gut. We drove to Niagara Falls from New York over Thanksgiving. How many hours was that, Kathy? Me flying is 2 hours from Minneapolis. That's not bad. That's pretty good actually. Of a flight, 2 hours. Just started carnivore diet a couple months ago. Got a blood test and they're all messed up. Oh yeah, everything is gonna be all over the place. So give it at least 6 months or so before everything kind of start to stable. Then when we do a blood test, we can kind of see where everything's at, because your body's kind of confused now. Well, do I use fat? Do I use sugar? Do I kind of put you in ketosis? Do I actually ask for more food, less food? So your body's all over the place for the first at least couple months. It's normal. High blood pressure with high heart rate. What can I do? It's some major deficiencies you have. It's not what you can do. You have to fix your food intake, and you actually will have to start fixing the deficiency. How can we lower cholesterol? I did an ebook on a couple of these things. If you guys go to my website and download some of the ebooks, would be great. What supplements or vitamins I should be taking going forward? It depends on your situation. I know you asked me a question earlier, but keep in mind, I've answered hundreds of questions right now. I don't remember, your previous question. You'll have to remind me, or you might have to actually book a time so we can talk. I'm giving a lot of free information, free valuable information. And you guys, when you ask me how to fix blood pressure or how to fix specific things, and I can throw at you a supplement or I can throw at you something, but that's not gonna fix your root cause. And you're gonna come back to me and say, "Hey, Maurice, whatever you gave me did not freaking work. You have no idea what you're talking about." Well, there's no such thing as a supplement being a magic pill. There have to be like a good lifestyle behind it and a good eating habit behind it. Then the supplements will actually work correctly. But still, that's why we do specific blood work to see what deficiencies you have, and we can actually attack these deficiencies. Because if you have deficiencies, we're never going to be able to fix your root cause. So if you just go buy supplements, it's like you taking medications. You're shutting down the symptom, but you're not really addressing the root cause. So the root cause is very important to actually look at it. And we already, if you tell me, "Hey, Maurice, I have blood pressure," well, I already know what is the root cause for blood pressure. But you have three different specific vitamins and minerals that actually are deficient. And if these three things aren't fixed, you're never going to be able to fix your root cause. Your time is priceless. Thanks for sharing. Thanks so much, Pete. I really appreciate everything and your support. It's very kind of you. So if you guys ask me, how can I fix triglyceride, or how can I fix my high blood pressure, or how can I fix certain things, if you guys are not gonna book a time or actually give me a full breakdown of your lifestyle so I can actually understand what's happening, I don't wanna direct you the wrong road and you end up not being satisfied or being hurt. So there's a lot of things you actually have to focus. And there's a lot of influencers out there. All they care for is just selling you supplement. Supplements won't do their job by itself if you're not gonna actually focus on your lifestyle. And do me a favor, guys, stop using food as entertainment. Use food to satisfy and feel satiated. Don't be using it as entertainment. Yes, you want to use it as entertainment maybe once in a blue moon when you go out on parties or holidays or family or gathering. But on a daily basis, you should actually utilize food as energy. You utilize food to actually support your microbiome, because you feed them well, they're gonna give you some good benefits. It's like me when I do a carb load once a week on a Saturday evening. I wake up on a Sunday, I feel stressed, depressed, and heavy anxiety. Why? Because it's the sugars, it's the fructose, it's the glucose, it's all that processing that I actually consumed has a side effect. So eat what's right for your body and eat what is mostly bioavailable for your body. And quality over quantity. Quality over quantity. Maurice has educated me through his consultation, and I preach to everyone. Thank you, Kayate. I really appreciate that. You guys have been the best. Maurice, what's your ideal daily meals when disciplined? I'm disciplined every single day except one day a week. So in the morning, so I eat 2 meals a day, and sometimes I eat 1 meal a day. So if I eat 2 meals a day, my first meal would be 1 pound of grass-fed, grass-finished meat. Mostly it is gonna be yak meat, and it's gonna be maybe like medium rare. That's it. I'll put some, maybe 1/4 to about 1/8 of a teaspoon of Celtic salt or Himalayan salt, and that's all I have. Okay, and in the evening, I like to actually, if I'm not gonna eat meat, I would either have probably anywhere between 10 to 14 eggs, or I would have like a wild salmon or sable. I like sable because they have very high omega-3, roughly about 50% in it, which is excellent. The only reason I eat eggs at night, and you gotta make sure your egg yolk is not cooked, because you can destroy your cholesterol, and that cholesterol will boost up your testosterone and will boost up your testosterone, and it has really good benefit to actually support tissue damage, which is really good. You don't like your cardiologist or doctor. Why? You see them when you practically self-medicate. The only reason is because here in Canada, if I want to get a blood test or get certain things, I still have to go through a doctor and get a prerequisite. And that's the thing. We're kind of tied in with a lot of these doctors and cardiologists. So you can not just walk to a laboratory and ask for blood work without a prerequisite from a doctor. So I have to kind of stay friends with them. I only use them for that. So maybe hard-boil the eggs might destroy some of the valuable part. If you're gonna hard-boil the eggs, so make sure you boil the water, put the eggs in the boiling water for 6 minutes. As soon as the 6 minutes are up, take the eggs and put them under cold water or ice. So you don't allow further cooking in the inside. And 99% of the time, the yolk is gonna be raw. I sent you all the information by DM, PM. I'll check it out for sure. We will get Maurice and Duke into the US and guard them with all. Cheers to that. That'd be excellent. I'll go there right now. What helps low blood pressure and what is the best magnesium for heart? It's gonna be again magnesium. If your magnesium is fluctuating and your vitamin D is fluctuating, that causes a fluctuation in blood flow. And blood flow is the main killer that causes heart disease. So we need to actually fix that up. Thank you. I heat them to just pre-boil and let them sit for 12 minutes. Okay, and is the yolk still pretty soft or is it cooked? Because keep in mind, in the yolk, you have roughly close to about 200 milligrams of cholesterol. The dietary cholesterol has nothing to do with your cholesterol at all. Keep that in mind. But the cholesterol in there is what gives you your proper cognitive function and what gives you the proper testosterone. If that yolk is overly cooked, you're gonna destroy that cholesterol because that cholesterol is heat sensitive. You remind me of the roofers on YouTube, brothers helping people in Canada. You gotta check that out. Give me a second, guys. I gotta grab Duke. Ziggy, have a good night. Give me a second, guys. Duke, Saccarto. Hey. Oh, he's still here. Duke is good. I have to check on him. I bought the Oxytrace minerals. How much do I take daily? Start with about 20 drops per 1 cup of water every 4 hours. And after probably 5 to 7 days, increase it to about 40 drops. Now, monitor your soft stool. If you end up having soft stool, then reduce that amount. That means your body is not absorbing as much magnesium as it should. Come here, bud. Up. Place. Place. Come on. Duke, look who's here. Come here. Oh, he doesn't want to stay. Duke, come. Hey, bud. Place. There you go. 3:10 a.m. people. I'm on the right owl duty. Wow, it's that late? Early morning, 3 o'clock in the morning. That's late. Let's see, what time is it here? Oh, okay, so it's only 8 o'clock here. I'm gonna show you who we have beside us. There he is. There's the big boy. He's back. Can you guys see him? There you go. Hey, Duke, what's going on? Where were you? Outside? Yeah? Did you have fun? Duke is too relaxed. Scrambled eggs and grass-fed butter thoughts. Scrambled eggs are okay, just the problem is, you just want to make sure you're not overcooking them. If you overcook them, you're just going to destroy that cholesterol. And that cholesterol is precious because that's what's going to keep your testosterone quite strong. I also got the nitric oxide you recommend. That's awesome, Steve. Did you start using it or not yet? How to get past the nasty taste of ionic magnesium? Come on, Blaine. You know the ionic magnesium tastes delicious. I don't know why you guys hate it. I still squeeze the bottle under my tongue and I leave it there for almost like 30 seconds or a minute before I actually drink water. Maybe you can put some lemon with it, maybe. Or something. Something citrus with no sugar in it. I just turned 51. I don't take any medications. Do you recommend taking vitamins and which ones? It's not whether I recommend taking vitamins. I would probably do a blood test to see if you have a deficiency. Why take supplementation blindly without knowing exactly what you're deficient in? If you're turned 51 and you feel great and no medication, The only thing is you wanna just keep an eye on is your nitric oxide, because nitric oxide drops by 50% when we hit age 40. And that's very crucial to actually maintain in our body. But I would not just take random vitamins without knowing exactly why would you need it or not, whether your body needs it or not. So sunny side eggs are best, correct? Yeah, as long as the yolk is as raw as possible. Can you take a grape seed extract with hawthorn extract? Yeah, they're both considered as being antioxidant, polyphenols, flavonoids. I'm gonna start taking a new supplement. It has about 1700 milligrams of polyphenols. I know I was taking a lot of the polyphenols separately, but now I found a company that actually has it as a combination, so I'm gonna be testing that. I bought 10 bottles to last me 10 months, so I'm gonna try it out. I'll be taking 1700 milligrams daily, and I'll do some testing on some of the biomarkers. What nitric oxide supplement do you use? Tommy, I have it on my website. The one I use is by Advance. What is it called? Advance something. There's two different ones. There's one by Berkeley and the one by Advance one. If you are you in the US or Canada? I keep forgetting the name of it. What's wrong with me today? I'll laugh on your live. This is rough. Hold on. Let me get the. Oh, you're in Houston. Okay. Yeah, Tommy, you can. The one I have, if you go to my website, so the one I take is by Approved Medical Solution. That's the one. So there's two different versions. Berkeley, they use their nitrate from beetroot and potassium nitrate, which is a beetroot. Sometimes some people have some sensitivity to slight oxalates, which is I didn't feel anything from oxalates. And the other one is by Advanced Approved Medical. They actually use it from arugula, so it does not contain any oxalates at all. And that's the one I'm currently using right now. But keep in mind, I've been using nitrate for the past 10 years now. Yeah, Approved Medical Solution. They sell only to professionals, not to the public, correct? Want nitric oxide. They sell only to professional. No, you can buy it because I have my code there now. You have to use my code so you can be able to actually get it, Francesco. Do you record your lives for reference later? Maybe you should timestamp them for simplicity. I do record them. All our lives right now, they're actually being recorded because I have the live running on TikTok and it's running on YouTube, and it gets saved on YouTube under the live category. So you can always go back and watch. The only downfall is it doesn't record the Q&A. So I tried to actually record the screen and try to attach the recorded screen with the audio. It wouldn't work, and it just was always off by a second or so because sometimes there's a slight glitch or slight delay with the internet or the phones, which is too bad. I wish they would come up with some kind of solution where it actually records the Q&A as well too, but I haven't been able to find anything like that yet. Approved Medical Solution, that's the one, yes. So you can actually, so I have a lot of individuals, they go back and they watch my recorded live, and just there's no questions. So that's why I actually read every single question I'm given. So anybody who's gonna listen to it, at least they know exactly what I am currently answering. It's late there. Hi, Dr. Maurice. Someone suggested to take hemp seed for fiber and omega-3, which also is precursor to arginine, which produces nitric oxide. Please correct me if I'm wrong. So hemp seed, the only benefits it has is the fiber. That's it. It does not convert to omega-3 at all. Our body cannot convert it to omega-3. So that part of it is pretty much is incorrect. And even thought it does have an action to actually activate L-arginine. The problem is anybody who's over the age of 40 or anybody who's has any type of heart disease, they cannot convert L-arginine to usable nitric oxide anymore. So what happens is if you end up consuming high L-arginine and ornithine or taking a supplementation without the cofactors, it would actually cause oxidative stress instead of actually causing proper nitric oxide release and actually help with the eNOS, which is endothelial nitric oxide. So technically it doesn't work for that at all. Would you not recommend beetroot powder or juice for whitening your blood? Again, beetroot, you have to consume 300 grams in powder or 300 grams in weight to get 500 milligrams of nitrate. It's not the beetroot itself that we need. We need the nitrate from the beetroot. The problem is every 300 grams of beetroot powder will give us only 500 milligrams of nitrate. And we need 500 milligrams of nitrate to activate the nitric oxide pathway. So that's very important. So that's why I've always said arugula is much better because all you need is 250 grams of arugula to get 500 milligrams of nitrate. The problem is if you don't consume 500 milligrams of nitrate per serving, you will never be able to have enough activation up to 8 hours of nitrate in your body, or else it'd be like a 6-second release and that's it. Great information and advice, but does one size fit all? Of course not. Every person is created differently. Whatever is good and healthy for you might be poison for the next person. So that's why there's no such thing as one person fits all, right? Or one diet fits all. Every person is very uniquely different. And that's why the blood work we get, we have to actually understand every person's biomarkers based on their diet to see exactly why you're deficient. So that's why multivitamins don't work, or certain supplementation that's man-made don't work, because they think that everybody is deficient in these vitamins and minerals. It doesn't work that way. For example, 10 man, you could be probably deficient in magnesium, but your body can only absorb 20 drops of magnesium every 4 hours, where you have another person, he could actually absorb 40 drops of magnesium every 4 hours. So every person is uniquely designed differently, from our gut, from our hydrochloric acid, into our digestive enzymes, how much we can intake. So yeah, and that's why like all my protocols that I make, it's not one protocol for everyone. It's one protocol designed specifically for that individual based on his lifestyle, based on the medications, based on the supplements, and based on his biomarkers. And that's the only way I can actually describe things or break things down for you guys. So it doesn't mean if I take 10 grams of D-ribose, you're gonna go ahead and do the same thing. 10 grams for me, it could be good because due to my possible heart disease, but for you, if you're a healthy individual, you should not be consuming no more than about maybe 5 or 7 grams, for example. So every person is different, and it's all based on how much mitochondria you have. Maybe if your mitochondria is at 80%, you don't need that much. You maybe only need 5 grams. So it varies. So without the blood work, we're almost kind of guessing, and there's no point of guessing. For arugula, you need 250 grams to get an equivalent of 500 milligrams of nitrate. Maurice, can I take straight eggs in the morning with the yolk? Yeah, 100%. Had a low voltage ECG. Can my poor sleep cause that? Sometimes, but the ECG, I think they're irrelevant. They don't really give us any proper detail about your heart. But it could be probably because of your sleep, or your HRV is it's not been stable. Best blood work to get? Oh, there's a list. There's a list based on exactly what you want to get. If you go to my website, to my community, you can see a lot of the information I posted there as an article. So if you guys like to read, go to Substack, and that's where my community is. And there's a lot of articles that I've written. And there's a lot of blood work. Some of it is free, some of it is paid as part of the community. So you can actually have access to it. So you guys definitely check it out. Maria, Farida, thanks so much for the flowers. I hope you're doing well. Thanks for all the information. I had the CABG on 2013. Gonna try to book a consultation with you. Just sounds good. Can berberine be taken longer term, and are there any side effects? The side effect is gonna kill one of the bacteria in your body that sometimes when you eat food, the food can sit a little bit longer than usual in your gut. So it is good that you actually cycle it. Hey Maurice, been a while. We need to catch up. Hey Nick, how are you? I hope you're doing good. It has been. What about sourdough bread? Sourdough bread is okay. You just still have it last meal of the day. I would never have it at first meal of the day just so it doesn't cause any spike in the insulin. Have a leaky valve and aneurysm in heart. Would you say magnesium is the most important mineral? I hear a lot of people talking about it. I think I made such a huge stir on magnesium with everyone for the past 2 years. Every week I put out like a video on magnesium, how important it is. Like if you guys want to know how really important magnesium is, when I buy the magnesium, I buy a whole year's supply just so I never run out. Been a roller coaster since we last had a chat. That's not good. Just want to see the difference between you and my doctor, always trying to learn for my health. Hey, I'm here to help you anytime you want some information. And trust me, I can probably give you 100 times more information than your doctor will ever will. I get a clean one with only 3 ingredients. So happy. That's awesome. Yeah, if you can get a good clean one, especially if the baker is they use like an old fermented, ingredient stuff for sourdough, that would be amazing. Supplement that a type 1 diabetic should incorporate: magnesium and nitric oxide. Probably book a call soon, Maurice. I'll WhatsApp you. Sounds good. Sounds good. Looking forward to it. So is there any help? We'll have to do a blood test. We'll have to actually check a few things to see, because a lot of these things happen is due to a deficiency in your body, Pamela. Once these deficiencies are fixed, then we can stop progression. If you never fix these deficiencies, you'll never be able to fix the issue or stop the progression. And if you're too deficient, you might have to do some IV therapy to actually catch up faster. I'm going to set up an appointment with you. Looking forward to it. Thank you, Maurice. No problem, Francesco. It was good seeing you guys here as well. And I know I can't see you guys. I just can see your pictures. But definitely looking forward to it. What did you put under your tongue? When? Just now? Recently? Oh, I took this. Nitric. I took the niacin. Okay, we'll see about contacting you. Sounds good. I haven't yet received my D-ribose, and hopefully soon we'll have to talk, as I have over 10 supplements now. You should get it on, it looks like I was doing the tracking. It looks like, because I sent 4 shipments to the USA, it looks like it's gonna arrive on the 17th. When is the 17th? So it's probably, you should get it on maybe either Friday, this Friday, probably. Yeah, it should be there probably this Friday. Can taurine and L-theanine be taken together? Yes. What kind of magnesium do you recommend? The magnesium ionic chloride. The only reason I recommend the ionic chloride, I have it on my website actually. It comes in a blue bottle. It's not man processed. It comes directly from Australian seawater. It has a natural magnesium and natural mineralization. And the only reason I recommend it because it has 65% elemental. All the other magnesium forms, which are man-made, they only have about 12% elemental. Oh, this is the niacin. I buy this locally here. We have the Now brand. Chloride. Ionic chloride. That's the most natural state of magnesium that is actually found in our water and found in our food. What causes eczema, like rash on scalp, at back? Too much hormonal foods? Okay, guys, I'll take one more question because I've been here for almost, yeah, it's been 2 hours now. So last question. You don't get flush and itchy? How do you do that? I don't, not as often. Not as often. I do in the morning when I take it, but in the evening I don't. I took two. I took 1,000 milligrams. Especially if my triglycerides are low, I don't get any flush sometimes. Is coenzyme Q10 the same as digestive enzymes? No, coenzyme Q10 is mostly specific for the heart muscle more than anything. Digestive enzymes are more to actually break down food correctly. Zinc glycinate works not bad. It's actually better for absorption because zinc does need a carrier, and what better way to have a carrier than glycinate? Hormonal foods, so anything like eggs, milk, processed, all that stuff that actually has any type of hormonal stuff in it will actually cause issues. Just found you on Substack app. Yes, Pete, thanks so much for joining. I just launched it, like I think it's been about maybe 14 days, I think. Just launched it, so I've been kind of writing all my articles that I've had for the past 2 years handwritten, so I'm just gonna put everything on there as protocols and some information as well too. How much of magnesium should one take per day? It depends on the body and depends how much you're deficient, because we're looking for RBC magnesium of at least 6 milligrams per deciliter. If you're like at 3 milligrams per deciliter, you probably need at least 200 milligrams every 4 hours, hoping that your body can absorb all of it. And sometimes you might have to add taurine or vitamin B6 to actually help with the absorption. I need to find the community. I stepped away from the phone. Kathy, if you go to Substack app, there is an app you can download, you guys, on your phone. Let me see if I have it on my, oh, I don't have it on my phone here. But yeah, it's called Substack. If you guys go there, you can actually download it on your phone, or you can use it on your computer. But it's probably on the phone is nice because you can actually read the articles and everything on there. We'll talk soon. Thanks, Substack. Sounds good, Abdullah. I will download now. Okay, guys, it's been about 2 hours. I do have to get going. I gotta go take my night stack supplements, and I have to actually sit for a bit before I go to sleep. It's called elimination. Yes, it's called elimination diet. Correct. Yes, same as my profile on TikTok. I put it. You guys have a nice, good evening and night for some of you, and good day for some of you, because some of you guys are internationally talked. Hopefully I did get your message, but I did write it down, and I'll check out the Telegram as well too. I'll just have to install it on my phone. In the meantime, you guys have a nice evening, and some of you have a good day, because it's probably daylight somewhere else. But we'll definitely, I'm gonna try to come in every day, hopefully they don't shut down TikTok, but I'm sure you guys gonna either find me on YouTube, or you can probably find me on Substack as well too. Would be awesome to see you guys there. Pete, you have a good night. Gozan, same to you. Ami, Abdullah, you too as well. You guys, everyone in TikTok, you guys have a nice evening. Kathy and Ziggy and everybody, if you guys already left. But in the meantime, you guys take care, and hopefully I can come back again tomorrow and chat with you. See you guys.